Can you open up your mouth?
Open.
We're gonna press and talk. It's okay.
Open.
The cheerleader take a sweet bone.
Just ran to his dad and say hi to him. He has never done that. Never.
So he's a lot more responsive today too. He's not as squirmish. Oh wow, that is a lot different already. It feels really relieving to not feel a cemented skull. There's a little bit of movement in there. I get surprised if it's this tight in an adult. So his has been just locked up and preventing his brain and his cerebral spinal fluid from really getting through. I can feel that's really forward. This side, this bone is rotated so far back. He's on the autism spectrum, and they've been working primitive reflexes for a year now. How often have you been doing those?
Every day, almost six times a week.
Yeah, and so she got a program for helping him with his ATNR reflex, his STNR, and his moral reflex and other things. And I watched with her, we went through the primitive reflexes, and she's been doing them.
Well, we have been doing it for 6 months already, and we saw very little progress in terms of primitive reflex integration. But after the adjustment and the visit with Dr. Salisbury, we just saw more posture control, like less swaying, and we just noticed that the reflexes are starting to integrate a little bit more.
When we heard that he had a forceps delivery, that's a vice grip squeezing on the skull bones to help him get out.
Multiple times, I don't know how many times.
The cord was wrapped around multiple times, so he had an ischemia and a lack of oxygen, which can cause developmental delayed issues, obviously. A practitioner like myself, I already know metabolically, we're not going to fix that with a drug. We have to feel what's gone on to the trauma. And his head feels like one big helmet. With babies, their fontanelle, even this area hasn't fully fused. It's very soft in a baby. The skull of a child his age is supposed to be pliable, more flexible. That needs to be corrected before the primitive reflexes, and that's something that was missed, right? So now that we were able to do this, we worked on him once, and there was a little bit of change, and I was able to feel like a little bit of release. And since that last time, tell us a couple things that were really distinctly different.
The major changes I noticed after the visit during this past 3 weeks, we've seen increased functional language. So he's starting to use language more functionally to express his needs and wants. Also more posture control. His back feels less tense. The reflexes are integrating more rapidly. And also the other therapies that he's doing, speech and occupational therapy, are working better. Thank you. Can you say thank you?
Can you give me a high five?
High five. Thank you.